From the News Channel 5 network, this is Pharmacist on Call.
Good evening, Nashville, Middle Tennessee, Southern Kentucky. Those of you out as far west as Jackson, Tennessee, welcome to Pharmacist on Call with your host, Dr. Sean Pruitt. And if you are watching this program, I am your community pharmacist. Well, everyone, welcome to the first show of season 3. That's right, we've been doing this for 3 years. Well, I guess close to 3 years, season 3. Wanted to welcome you all to your 1-hour forum. This is where you get the opportunity to ask those burning questions that you've been kind of wanting to ask, but haven't had the availability to speak with your doctor or your pharmacist, because let's face it, they're busy with the way the healthcare system is. Or those questions that you thought were silly and mundane and, I don't want to waste the pharmacist's time. Well, this is your 1 hour to waste my time. So we understand that they're busy, they don't have time for this 1 hour. I do. So just wanted to do a couple of shout outs here. Wanted to shout out the MAOP, which I believe is the Minority Association of Office Professionals over at Meharry. I was able to meet with them and be a vendor at their I guess it was the President's Day's inauguration of President James Hildreth as the president of Meharry Medical College. So I want to say congratulations to him, certainly to him, and also to Cynthia McNeil, Dorothy Murphy, who are officers in MAOP, and I appreciate them inviting me over there. I also wanted to say a big shout out to Miss BJ, who's at Meharry as well, and to give her piece. Well, I guess to my Latin viewers and my Latin patients and colleagues, wanted to wish you all a happy Cinco de Mayo, and wanted to, well, I guess let me clarify, because I know they would probably want me to. It's not Mexican independence. That happens on September the 16th. But Cinco de Mayo is actually a celebration of a battle that happened in a city called Puebla in Mexico, where the Mexican army kind of withstood the onslaught of the French, but were eventually defeated. So it's actually a celebration of that revolt that took place in Cinco de Mayo, and I forget the year, in the 1800s, I believe. So that's what that's about. So with that, I want to say a shout out to Mr. Robert Chavez, who is the clinic director over at La Clínica La Paz, which is the largest Hispanic clinic in the area, and Mr. Yuri Kunza, who is the executive director at the Nashville Area Hispanic Chamber of Commerce. So I want to give a shout out to you two gentlemen who are very influential in the Latin community. I also want to give a shout out to my two favorite Mexican joints, Casa Fiesta on Bell Road, who I know y'all are having a great time over there right now. And to my other spot, it's Don Julio's now, but it started out as El Mariachi and La Hacienda on Gallatin Road over there by East Palestine and Madison. So my two spots over there. But this show is about you, so I'll finish my shout outs later. But we've got a caller online here. Welcome to Pharmacist on Call. How may we help you?
This is Marcus.
Yes, sir. How may we help you, Marcus?
I got a question. I've been washing my clothes, and I don't think the soap out is coming out of my clothes too well. I get the itching and scratching and getting rash all over my, and anything else I can take besides Benadryl. I don't like the way the Benadryl make me feel.
Well, the only other thing you can do is rub something topical on your skin. So it could be a Benadryl cream or something like calamine. Now, is this happening a lot with the washing powders? Okay, so assuming that this is happening a lot, maybe you should switch to something that's hypoallergenic. I believe that there is one made by All, which I believe we used when my daughter was born, and it's free and clear. It's a hypoallergenic formulation, so that won't itch you. But Benadryl cream, hydrocortisone cream, and you may even have to do a doctor's visit to get maybe a steroid pack, something like methylprednisolone or prednisone, which is a steropred dose pack. So those would last you about 5 to 6 days. So it may be worth a doctor's visit if it's really irritating you. But let's try the Benadryl cream. All right, looks like we got the caller online too. Welcome, Thelma. Welcome to Pharmacist on Call. How may we help you?
Thank you, Dr. Pruitt. Good evening. How are you?
Pretty good. How are you?
I'm good. I'm calling to find out if you have a vitamin product that is more geared to just seniors, or would the beetroot juice and your regular organic vitamin mineral formula be just as effective for very senior people as well?
Good question. Place you on hold here. That's a very good question. So what I have is a formulation called, I believe it's Sentry, Silver, S-E-N-T-R-Y. And because your vitamin needs are different as you approach the age of 50 and above, these are specially formulated for seniors. So we have that. In terms of the beetroot juice, it will supply you some vitamins, but not all that you would need. And so you would need a multivitamin. Plus, you can add on the beetroot juice, certainly for the therapeutic benefits with the diabetes and the hypertension and the low iron, but also supplement with a silver multivitamin, and that could be in liquid or tablet form. But yes, we do carry specific age-specific vitamins for seniors. Yes, ma'am. Okay, looks like we got another call here. Pharmacist on call. How may we help you?
Yes, this is Raya Ford.
Hi, Raya. How you doing?
I'm doing okay.
How can we help you today?
Recently, my husband was in a hospital for a stomach virus.
Yes, ma'am.
And they've been giving him fluids and nausea medicine and stuff.
Yes, ma'am.
But since he's been home, I've been giving him Pedialyte, Pepto-Bismol, and other fluids, but it's not doing anything. And he's constantly having headaches, and I've been giving him Tylenol, but it's not doing anything.
Okay, how long has he had the stomach virus?
A couple of weeks.
Okay, now that's odd. Generally, it will kill itself off in 5 to 7 days. So he doesn't have any other type of stomach issue?
No.
So they didn't. Okay. So what are the main symptoms that he's having?
Nausea.
Okay.
And today when he came home from work, he said he was throwing up.
Mm-hmm.
And this pharmacist said that he's probably dehydrated. He's not drinking enough fluid.
That certainly may be the case. Now, is he talking about any pain or maybe the left side of his stomach?
It's the middle.
In the middle of his stomach? Okay.
Yeah.
Okay. Is he diabetic?
No.
Okay.
He don't have any health problem, but just high blood pressure. But he takes his high blood pressure medicine.
Okay. Did they, okay, well, assuming that the caller is hung up, what they could do is, I'm not sure if they drew blood or not, but let's take a look at his pancreas and make sure he doesn't have an acute attack of acute pancreatitis, which he may have gotten from eating some of the wrong thing or anything to that effect, which can look quite like these symptoms. You'll have the fever, you have the nausea and the vomiting and the pain in this area.
Mm-hmm.
So maybe ask the doc. 2 weeks is too long to have a stomach virus. So let's ask the doc to maybe look at his pancreas or maybe even his liver, which if both are inflamed in an acute process, they can manifest themselves like you're having a stomach virus.
Okay.
Mm-hmm. Yeah, but in terms of helping him out, if it's his pancreas, yeah, I'm thinking in both situations, he's probably gonna need to see the doctor because I can imagine it will be pretty painful. We'll get into it a little later, but actually the beetroot juice is good for that as well because it helps heal the pancreas and deal with some of that inflammation. Sorry.
You said
beetroot juice, yes, ma'am.
Beetroot juice. Where you get that at?
At Pruitt's Discount Pharmacy.
Oh, okay.
Yes, ma'am. And the producer will flash the information at the end of the show. So just make sure you continue watching, and she'll tell you where to get it and how to contact us.
Okay.
All right. Thank you, ma'am.
Mm-hmm.
All righty. Bye-bye. All right. We got CC on number 2. CC, welcome to Pharmacist on Call. How may we help you?
Hi, sir. How are you?
Pretty good. How are you?
I am great. I take blood pressure medication, and I found this green tea that's Garcinia.
Cambogia?
Right.
Yes, ma'am.
And I'm not sure if in taking the medication that would be too much for me in terms of the caffeine.
Okay. So is it it's not a caffeine-free tea? So it's green tea and Garcinia in it?
Right.
Okay. With high blood pressure, Yeah, probably. I'm not sure where your blood pressure run, whether it's stable on your medication or not, but the tea with the caffeine is going to push your blood pressure up. But
Okay.
outside of that, it's a good tea. Green tea with its antioxidant effects, certainly the energy, and then the Garcinia cambogia, especially if you want something to help suppress your appetite, if you're on a mission to lose some weight and also lower your cholesterol. Garcinia is good for that.
Good. Okay.
Mm-hmm.
Okay. All right then. I might come to your store and let you look at what I take, because some of this I can't even pronounce it. I do apologize.
No, that's fine. We'll help pronounce it for you.
Pardon me?
We will pronounce it for you.
Okay.
Mm-hmm.
Well, then I'll stop by your store.
Yes, ma'am. All right, we look forward to seeing you.
Okay. Thank you so very much.
Okay, thank you. All right, everyone, stay right there. I see those phones lighting up. We'll be right back in a minute.